Good morning and good evening, everybody, and welcome to this special version of the Better Managers broadcast. I'm Anne Franca, the Chief Executive of the CMI, and today we're bringing you a very special edition of the Better Managers briefing, where we really focus in on what we can learn from the way in which this pandemic has been managed in the Asia Pacific countries. And I'm delighted to welcome as my guest today the four chairs of our CMI branches in those regions: Dr. Paulina Chan, the chairperson of the CMI Regional Board in Hong Kong; Indra Kaushal Rajapaksa, the president of CMI Sri Lanka; Taranjeet Singh, the chair of our CMI Regional Board in Malaysia; and Tae Woon Tek, the chairman of our CMI Singapore branch. Welcome to all of you. I'm so grateful to have you here with us this morning. Now, before we get into the questions, I wanted just to set some context. I wanted to share with our audience some statistics from your countries regarding COVID and compare those with the UK. So, for example, in Singapore, we've had 60,000 cases of COVID thus far and 29 deaths. In Hong Kong, we've had 11,000 cases of COVID thus far and 202 deaths. In Malaysia, we've had 314,000 cases of COVID thus far and 1,186 deaths. And in Sri Lanka, we've had 86,000 cases of COVID thus far and 511 deaths. Now, in the UK, we have had 4.2 million cases of COVID thus far and 125,000 deaths. And I find this difference quite staggering. So the very first question has to be, all of your countries, even when population differences are taken into account, have had much lower case rates and death rates than the UK. And generally, the economic impact of COVID has been less severe. Now, what do you see as the main learnings that the UK and other countries harder hit by this pandemic can take from your experiences? And do you think that going forward, we should see greater levels of international cooperation around such crises with regards to, for example, preparation, travel, and indeed vaccinations? And I'd like to start with you, Woon Tek.
Thank you, Anne. And to all our friends in the CMI, good evening or good morning. Anne asked, what are the learning points that we have? Actually, in Singapore, and actually in most Asian countries, you got to understand that we went through SARS in 2003. And SARS have taught us to trust science. We have to trust the science. We have to trust that the decisions that are taken has to be based on science and not on the wishes of the people. And if the science says that you have to wear a mask, we wear a mask. If the science says that we have to make sure that we have less interaction to prevent the risk of transmission, we follow. And in Singapore, we went through a very difficult patch because in April last year, many of the transmissions involve our foreign workers living in Singapore. And if science says that we have to go into a circuit breaker to go into a temporary lockdown and we have to isolate them, we have to do it very fast. So trust science. The second thing is enforcement. We are fortunate to have learned from SARS the importance of contact tracing. You got to be able to quickly isolate people who can be a potential cluster to transmit, and you actually isolate them very quickly. Now, this enforcement involving very detailed, hardworking contact tracing has to be done so that you doesn't kill the economic activity. You're able to identify where the sources of infections are, isolate them fast enough so that the rest of the population can carry on life as usual. And we learned this very hard way during the SARS time, the need to put in enforcement and effective contact tracing. The third thing that we learned during the SARS is the need to make sure that we have special facility to treat this kind of infectious disease. So Singapore had a long-term planning. We put in the NCID, which is a National Infection Disease Control Center, where they are able to cope with, it's a specialized hospital, able to cope with infectious disease. So I think all this help to reduce the fatality rate. But I have to say, every life is very precious to all of us. A life lost is a very sad story for many here, and my sympathy goes to those who actually, pass on as a result of this infectious disease. Over to you, Anne.
Thank you. Well, some great learnings there, some wonderful lessons, and thank you for your sympathies. And Paulina, Hong Kong also went through SARS. What would you add to Woon Tech's observations about why you've been able to cope better?
Yeah, I share the sentiment of Woon Tech. Hong Kong also, had experienced a painful experience of SARS, 20 years ago. So every citizen has learned, all the risk and crisis management. So everybody is putting on a mask, immediately, and trying, and really working hard, for the social distancing. And on top of that, personal hygiene, is a high priority across all ages. And from government perspective, there are cross-government department, collaborations with true executive power to implement, such a program. For example, the Hospital Authority, the Transportation, the Education Bureau, and the Social Welfare Services. And they collaborate, and also, for two things. Number one, quick diagnosis, of the virus. And secondly, a quick quarantine center, in order to isolate, the cases before, it could be released. I think this is very important. And citizens are very collaborative and also cooperative, in this way. So we have a very agreeable community. And then I also want to say that CMI is one of the, actually was the pioneer to have the awareness webinar as early as January the 27th, 2020. To make all, we invite, all our members across regions also. So my colleagues, from Malaysia, Singapore, Sri Lanka were invited. And also we collaborate, with other professional societies. And also Imperial College, because Imperial College London was actually the forebear of studying, research, on COVID-19. So at the professional level, we make them, all aware, of that. And then at the implementation level, of course, the government, in collaborations. And then, yes. And then internationally, I think we continue to collaborate, with the diagnostic and testing. And we could sharing resources and also sharing tips, to all citizens. So,
thank you. So those, again, some excellent points. Now, and you've mentioned the importance of the international collaboration. Now, Taranji, Singapore and Hong Kong are very small and contained geographically. Malaysia is, as we know, larger with a larger population, and more dispersed. And yet still, a very good record so far in that country. What are your learnings as
Sure.
to why that might be?
Sure. So thank you, Anne. And I think this is a very pertinent question. But allow me to just set some context for this so we can provide a better background. Malaysia has been impacted very badly economically as well by the COVID, as other nations. GDP went down drastically. We were in the -6% from last year. By and large, on a year-to-year basis, it's about 4.5 to 5.5% on average. It's estimated that over 200,000 businesses have closed over the last 1 year. And that 200,000 businesses, including a projected of 50,000 for this quarter alone. You can imagine the implication that has on employment, the implication that has on the way we are currently working through our day-to-day lives. And right now, the estimates are that we've got approximately 750,000 unemployed. And that figure goes up all the way to about 2 million, depending on who you're speaking to. Now, the interesting thing about this is these numbers are all lagging indicators. We won't know until the books close, which is in about a quarter from now. But what is, I think, more emphatic is what does it look like moving forward? Now, I totally hear you in terms of the statistics that you've put out, and let me address that right now. The first thing is the prompt and decisive action from the Ministry of Health, by the SecGen himself, from the Honorable Prime Minister as we were hitting the February-March timeframe. And Prime Minister took the very harsh decision of locking down the nation. It was not specific cities, it was not specific districts, it was the entire nation. Why? Because you have interstate travels. You have travels along your different districts or counties in the case that we have in the UK. And the moment that took place on the 18th of March last year, there was an immediate arrest in the way that the virus was being transmitted. The second thing that came up was the overarching appreciation, and I concur with what Wuntek has just stated together with Paulina, the appreciation by the citizens to say, look, we don't want to mess around with this. Mm-hmm. And we are not talking about us being submissive, but we are talking about us trusting science. If this is what is required, this is what we will do. And I have a point of view, which I will talk about later, about democracy and what democracy has actually led us to. But we'll talk about that on another note.
Okay.
And one of the things that then played out was, whilst you have the normal dissenters against these actions, but by and large, everyone followed the personal hygiene requirements that were laid out. Everyone followed the requirements laid out by SOPs, and we didn't dispute it because it's the right thing to do. One of your questions then asked about what would be one or two things moving forward, Anne. And I see two things here playing out. The first one is stronger ties between governments, mm-hmm. more so than before. And I'm not just talking about economic ties, I'm talking about health and safety ties in this regard. Vaccine passports, what does that look like? How do I know that the guy is being vaccinated with the proper type of vaccine even before he boards the flight? And we are already seeing COVID tests being mandatory before you take a flight out. But what about these vaccine passports? Mm-hmm. And the single beneficiary, I would imagine, would be folks who are foreign students. That has been tremendously impacted over the last 1 year. The global nomads, as I would call them, people who are able to traverse from one country to the other, as an example. And the second thing I would like to highlight moving forward is a very hybrid approach for organizations. Work from home versus work from office. How do we go out there to balance the two? And empathy, in my mind, is going to be absolutely crucial. So a couple of things here for yourself in terms of our takeaway would be the decisiveness and the promptness with little or no arguments around why these activities are being looked at. Anne, over back to you.
Thank you, Tanjeet. Well, there's some very common themes here emerging: decisive action, prompt action, belief in science, and wanting to comply. Kaushal, in Sri Lanka, do those themes resonate with you? And do you agree with Taranjean's point that we need greater international collaboration going forward?
Yes, of course. I'm thankful for CMI UK for organizing this very important discussion. And as Taranjit said, and also Paulina and my colleagues, in fact, we need to have greater collaboration, because one thing is to exchange the strengths that we have, and what lessons we have learned. Because in Sri Lanka, at the beginning of the COVID, we had for the first 2 months, we went for lockdown, not the whole country, the areas where it was affected, and we had only 930 cases and only one death. And it was a new thing for all of us to have a mask and keep the distance. So it took little time for our public to get used. But I am thankful for our government, the health sector people, and also the forces joining hands and carrying out the best of traceability, contact traceability, and that helped a lot to isolate and lock down only those areas where it is affected. By doing that, with the investments that have been made in the last decade on the health sector, we were able to have the proper healthcare facilities for the public. So that is one of the areas that we were able to, contain this virus. And also, at present, as you mentioned, we have almost about 86,000 affected cases, but only about 3,000 people in the hospitals, and about 500 deaths. Now that the vaccination have started, there again, people had a doubt about the vaccination, but the government went on a program of making awareness for the public, and now people are queuing up for getting the vaccination, and we have almost done about 500,000 vaccination at present, and I see in the newspapers that they are going to get down another 1 million. So we can see little by little the life is getting back to normal. I agree with Tranjit, because a lot of economically it have been a very bad thing for the country, but government also started promoting local production and restricting imports, what can be produced in locally. So that made a great impact, because in the last 1 year we see a lot of entrepreneurs, startups coming up with alternative products for the as import substitution. So this is a very valuable thing which I want to share with all of you.
Well, thank you for that. And there's a real common theme emerging. You've all mentioned, obviously, decisive action, but you've all mentioned the impact of very successful and swift test and trace, so contact tracing. And actually, in the UK newspaper this morning, in the Times, there is an article that's saying that despite investing 37 billion into the NHS test and trace, it had no measurable impact. So certainly, I think we can learn from what you did in your test and trace, because obviously it had a much greater impact. So moving on to some of the other things that you've all mentioned, much has changed in terms of how we manage and lead in COVID. You've mentioned some of these things: swift adoption of technology, remote working, as Taranjeet highlighted, the challenge to well-being, and the importance of empathy and communication. Our CMI research, as you know, has highlighted many of these trends. Which of these do you think should stay with us post-COVID, and which do you think we might want to change and move away from? What do you think are main themes as to how management and leadership in the future will be affected post-pandemic? And I'd like to ask Taranjeet first to kick us off on this.
Thank you, Anne. Very pertinent question. And I think I would like to just restate a view that I've held very dearly. People talk about the new normal. There is nothing new about this normal anymore. It is the normal. And if after 1 year, we are still talking about the new normal, I think we have to do some self-reflection. So that's the first thing I would like to put on. And the fact that this is now the normal, I think we need to now review what's playing out with this. And there are a couple of themes that I would like to highlight, Anne. And the first one is the voice of employee has become that much more stronger. And more so today than ever before. And the ability for dissonance has now started to emerge. Long have gone the days where we are shepherding sheep, but right now, if people feel very strongly about it, they will say no. And we will go down to social media, and you're seeing it playing out on almost a daily basis. So that's the first thing. The second thing is you now find employees having more comfort in their views being held, and they don't mind talking about it. So not only am I stronger in my point of view, but I'm also now openly sharing this with everyone else. There is a fundamental issue on true deep engagement levels. The days of me having communication sessions, very superfluous, very verbal, have gone. It has to be now more meaningful. And that now becomes a prerequisite. Almost to the extent that if I add that into the demand of social intelligence that is driven by organizational network analytics, actually using data to talk about trust in the organization, to talk about the flow of communication, how effective are these communications across. And you see that playing out now more so simply because we are virtual. The ability to call 5 guys to the table no longer applies because they're staying at home, wherever home may be for them. And I would like to end with 2 things here. And this is a bit of a mantra for me over the last year and a bit. There are 2 fundamental factors playing out, and one is cost containment. At all expense, I need to maintain costs. I can't have this blowing out of proportion. And the other one is cash preservation. We need to make sure that we have enough in the war chest to tide us through. We don't know how long this will last. Research has shown that chances are it may be another 2 to 3 years before some level of normality, and I dread to think what normality means, but before some level of normality comes in. And if cash preservation and cost containment are 2 fundamental areas, activities that we do in the workplace, outcomes that we are driving in the workplace must, in my mind, resonate with this. And that's one of the principal things that I see coming out of this pandemic. And
so a lot of very excellent thoughts there. Greater employee centricity, greater employee voice, and empathetic leadership combined with cash and cost control. Kaushal, what about your views? What do you think will emerge from the pandemic in management and leadership terms?
Actually, it is quite interesting because today the whole world are brought to your footsteps. Like today, we are able to communicate with each other because of the technology that had evolved after this pandemic. So the pluses is that the things that we couldn't do, right? I mean, for an example, although we are a small country, we couldn't communicate or meet the people in the far area as far as our courses are concerned, but whatever the study. But today, within a few minutes, you are able to communicate seeing each other. So that has given a lot of advantages. And not only that, I know one of the very, very leading management companies like KPMG, where they have encouraged people to work from home, right? So this new trend is developing, and it is being practiced by, actually it was practiced by even the state sector. Only after many months, today the government have asked the staff to report for work physically, because things are very much under control. So I think the pandemic now, as Ranjit said, it's not new normal. Now we call it now normal, right? The traveling time of people, I can give you a nice example. What one of the corporates have done is, now normally their time of working is start from 8 o'clock to 5. That's the normal general time. And in the suburbs of Colombo, is heavy traffic in the morning. So they have permitted the managerial staff to start their work, because normally they leave home at 6:30 to get to the office at 8 o'clock. So they are being allowed to start work from home at 6:30, and they can leave their homes at 8:30. So they're totally avoiding the traffic. So 9 o'clock they are in office within half an hour, whereas they would have had to spend 1.5 hours on the road. So by which they have, the CEO was telling me, Kaushal, we have improved the productivity. The projects that took 1 month to complete, now we are able to complete within a couple of weeks. So I think these are the pluses of the pandemic.
There's some great examples there. Thank you. And by the way, we're going to be taking questions. If you have a question, please put it in the chat function. Thank you. Now going to you, Paulina. What have been your learnings?
Absolutely. I think the COVID-19 is definitely a disaster, a world crisis. But on the other hand, it generates, new opportunity for new management style. Mm-hmm. For example, the major theme to me, number one, a new way of communications. It is no longer a hierarchical, communication. It's more of a project management, because anyone on the workforce, anywhere in the world, anytime, could reach, 3 levels of leadership and anywhere. Mm-hmm. So as the leader and manager, we have to be prepared, for things that we no longer, in the past, maybe shelter for a few hours, no longer, because it's immediately, getting, to us. Another theme I think is very important is the technology and business integration, using all kinds of intelligence, big data, data mining, is right at our fingertips. As the leader and manager, how are we going to make full use of this, treasures information and implement it to the benefits, to all, not employee, clients, and everywhere. And the remote, communications and the cross-region, virtual communication can never be replaced by some impersonal touch. Mm-hmm. And that, is the value of the employee, very important. And also the attention to our clients, very important. And not everything is a task-oriented. We can see that ourselves and myself, doing, 300 times, as productive to solve problem. But it's all task-oriented. And how about, do we care about my team? How do we care about our clients? I think this is, we need to, add on. And anywhere, any place, anywhere, I think it's going to be here, and we are not going to replace it, but we just need to add on, the empathy. That is one thing. And of course, we also aim at speedy recovery, of the crisis. We want to lift social restriction. And also, with this, we generate many new business. And managers should learn, how to manage new business. For example, personal hygiene business, conservative, environmental conservative business, and also how are we going to adopt the use of technology so friendly and so transparent that it is like using a ruler to draw a straight line, as easy as that. And, and it's Yeah. So this is how I see what should keep and what should replace, in the post-pandemic era. Thank you.
Thank you. Some very big themes there. A lot of universal themes. But Woon Taek, what are your thoughts on what are the lasting learnings for management and leadership out of COVID? Oh, I think you're on mute.
No, I think, and what is very key to me is we have to come back to what is the human value in a job.
Mm-hmm.
I think we are moving the digitalization process has actually been accelerated through as a result of COVID. But actually, a lot of us as managers and leaders are not ready for this rapid acceleration. Why? Because the jobs are disrupted. The human value in the job clearly has been destroyed. And I'm talking about as leaders, how do I make sure that the human value in a job can go up? How do I make sure that people doing a job are not underemployed? They are not doing a job for the sake of earning a salary. They get fulfillment, right? They get fulfillment. They enjoy what they are doing. So I think all of us today are thrust into something that is new. Why? Because many of the jobs are designed during the industrial age revolution. Today we are moving into a information age and a conceptual age. And if you're moving into information age and conceptual age, the job has to be redesigned to preserve human value, to make sure that empathy is there, the trust and confidence in human is there, and not delegated all this to a machine. And that is a danger that I think we need to avoid.
Yes. Well, there's some very good themes coming out. Rapid adoption of technology is making the humanity of how we manage and lead even more important. That has actually resonated with CMI's research. But before we get to our questions, and I do want to have time for questions, I'm going to ask each of you if you can quickly share with our audience what is your greatest learning as a leader for you personally coming out of this crisis? So your greatest learning personally as a leader, and what's your one biggest piece of advice to all of those who've joined us this morning on this call? And Paulina, I'd like to start with you.
Thank you, Anne. One thing which is really personal to me is the use of video teleconferencing. That was my PhD thesis in the last century. And had I, of course not, as a student to get the patents or others, and I would be doing a lot of charity work, more than I would like to. But I'm so glad that it takes so long, for every one of us to use it, as everyday life. So this is very personal. And then secondly, I also feel that to manage anywhere, any place, anywhere is a definitely, going on, from now and into the future. But I am very concerned about my women professional colleagues, because, women are very resilient, into the new environment. And then the flex hour, the restrictive and the restructuring, would really, a good test, of the self-confidence. So as the manager, as the leader, I am very considerate, of their needs,
And I think that's a great piece of advice. The impact of this on women has been greater. So a good piece of advice to assess that impact going forward. I think we might have lost Paulina there, but I'm going to move to you, Woon Taek. What's your biggest personal learning and what's your biggest piece of advice?
I think my biggest personal learning in this digitalization process is how do I preserve human value in the job? And how do I help people build new capabilities and cope with a rapidly disrupted job market, right? I think all of us have a duty and responsibility to design jobs that has human value inside, that has a larger purpose of showing care, love, and inclusive leadership.
Mhm.
Those are critical. It's not about productivity, cost efficiency. It's while we want to achieve productivity and cost efficiency, we must bear in mind that nothing can replace machine.
Yeah.
Right? That the exercise of empathy, trust, confidence, okay, the exercise of care, diversity, protecting the environment, right? Creating uh, uh, careers for our people, including the women. These are all very precious human values that are built over many, many centuries. Let's not forget that we owe a responsibility to the people that we lead, that we help them find the meaning of the job. We help them find and preserve the human value in the job.
So your personal recommendation and learning is the exact the same as your recommendation and advice to preserve that human value. Thank you. That's
Yes.
very poignant. And Kaushal, what about your personal learning and piece of advice for our listeners?
Actually, I think as a result of the pandemic, I think we as leaders and managers, we have to be more purpose driven
Mhm.
than plan driven. This is a new scenario I believe that we have to adapt. And I agree with all my colleagues about digitalization, everything about new technology. Fantastic. At the same time, there is something that we have learned really from this. The most importantly, how to take care of your hygiene and discipline yourself, right? So this is something which have been taught to our taught was our great grandparents, parents, right? So we didn't care it, but now you are forced to live with it. So I think it has brought a good lesson. Other than the new technology and all the new evolution of way of working also, because the way of working in when you say work from home, that is you are building confidence on that particular person. So you automatically get used to that, and you got to do the job properly and to fulfill your task. you
Mhm.
cannot you cannot just uh, sham or do anything like that. So there is some confidence that you build in yourself and also the company management. So let's think positively, because this pandemic have brought in a lot of good things, as you can see all what we discussed. Thank
Yes,
you.
those are some great, and yes, we've all learned to wash our hands and also to trust that people working from home. Those are great learnings. Taranjeet, what about you? Your personal learning and piece of advice?
Okay, so I'm intrigued with the discussion, and I thoroughly love it. So in response, if I may, just take a minute or two here, and Wuntek raised a very good point around human centricity, and the fact that we must not let technology supersede. But I approach it in a slightly different fashion.
Mhm.
The jobs that we have right now, if you're still running jobs which were of the industrial age, I think we are in a wrong place right now. We need to be moving up if you've not already done so. And what we are seeing right now is an exacerbation and a compression of time. We've seen the IR4 coming into play for the last decade. The question then comes in is, what have we done to try and adapt the work that we're doing to try and lift the game that we are currently playing, given the fact that technology is already on board? So to say that we need to balance the two, absolutely right. To say that one has to be give instead of the other, maybe not. And that's my view. The other one that I think is also crucial, and this is my learning as an individual before I go to the professional side in terms of advice. But my learning as an individual is this notion, and I alluded to this earlier, and is the notion of the spirit of the Western-based democracy. We go out there and we talk very, very proudly about how democratic we are, and all of us. However, when it comes to the real spirit around it, is it actual collective good, or is it self-interest driven?
Mhm.
I do not want to wear the mask. Why am I not allowed to go to the beach? Why are pubs closing? And this now is a very self-driven approach rather than a collective base that I alluded to earlier, which you now see playing out very nicely in APAC, in most instances. And it's about us, because the saying we have in Malaysia, and I will quote it in Bahasa, is "Kita jaga kita." We look after ourselves. We will not let other people look after us, because it starts from home. So that's the first thing that I would like to share as an individual. And I found this very intriguing. But the advice that I would give, and this is a mantra that I've had for quite some time, is the following. We need to relearn things, whether it be the way technology is being used or the way we have an impact on how this technology ladder is being applied. We need to reframe ourselves in terms of our mental model and in terms of our operating model. We need to reposition. The old days, and as much as Wuntek would like, and we will have a nice debate on this, some jobs have just disappeared. These jobs have gone, and no matter what you do, they ain't coming back. So what do I now do to reposition these individuals in this regard? That's a third one. And lastly, how do we seamlessly execute this? It's not about talk, but it's about action. And it's not about activities, but it's about outcome. Nobody knows what the answer is, and that's what it's all about, because we are in such a novel environment right now. But that's what it's all about, right? How do we now learn from each other? And back
Yeah,
to you.
some very important learnings there, and the question about individual liberties versus collective responsibility it's a very insightful point, and it leads nicely to our first question from Amir. He's asking, the lessons learned from SARS are fascinating to hear. It just seems that many Western governments could have and should have used the SARS crisis to be better prepared ahead of COVID. Do you think this is the biggest example of a failure in risk management in the last century? Well, let me ask Wuntek what he thinks of that question.
I think people understand the risk, but it's about what do you do after you understand the risk. You need to take action. So risk management is not about understanding how catastrophic it can be, but there lies in this issue about public spending and democracy. If you have to win elections every 4 years, and you have to please the masses now in order to win elections, you can't be thinking 10, 20, 30 years. SARS happened in 2003. Singapore spent the last 17, 18 years thinking about how to protect the citizens if another pandemic happened. We write the manuals. We build the special purpose hospital, right? We put in the cameras. These are very long range planning. If every politicians are worried about winning elections in 5 years, I think you can't do risk management for pandemics. I think we have to have more long range planning.
That's a fascinating point. Kaushal, anything to add to that?
Yeah, I agree with yes, I agree, and I think it's time for us to rethink and change our strategies, both by the state and also by the private sector as leaders. So one thing is trying to cut down your costs and improving the productivity is today's norm. And if not, you get as Ranjit said, many have to close down or you go out of business. So we got to, while embracing the technology, that's fantastic, but there are a lot of things in where you can make more productive by using your best practices of what you have learned in management. So this is the message I can bring.
Well, that's
Thank you.
thank you, and it's a fascinating point. What also you've both raised. So risk on the risk register. To Woon Tech's point, a pandemic was actually number 2 out of 100 on Lloyd's of London risk register, but actually there was no action plan for it. That's to your point, Woon Tech.
Yes.
Very interesting insight. So our next question is from Kamal. Post-COVID, many companies will keep the work from home concept as much as they can. But what concerns does this present in terms of employees' mental health? Paulina, you mentioned well-being. What do you think?
I think employee mental health is the most important area that any company or leaders, need to, pay attention to. Without a happy employee, you don't have a happy team and you don't have a good metrics. And so the needs of the employee are as important as the needs of our clients, because our clients, one day, as the international collaboration is concerned, it's in the management partners. So for well-being, we have to take care of 2 things. Number one is physical well-being. Sitting, in a confined space, working at home may not be the optimum, health, for all of us. And for mental health, the stress level, if we go across time zones, 24 hours, without, stop, we really cannot tell, we need to have the balance of time-life management. And so this is very important. And on top of that, that also open up new resources and new business. For example, hygiene business, environmental business, all these lead to the improvement of well-being, and less, focus, on our resources, our collaborative effort, and also understand the needs of our clients and employees. And we can only go, on a totally positive way. We're full of positive energy. Thank you.
And Taranjeet, you mentioned employee centricity. What about mental health?
So I think, I know they are correlated. You do see the direct linkage between how employees are playing out on the ground to the way they are now thinking, and the impact that has on their work, and their social life, on the family life. And I think it behooves us as effective managers to empathize. In the old days where I could switch off my computer at 5 o'clock because I'm taking the tube back home, no longer applies. And today, more so than ever, I'm finding it. My hours are phenomenal. It doesn't stop. It doesn't stop. And I'm thinking to myself, hey, question that I ask myself, am I more productive? I ask that, am I getting a lot more done, or are they just meetings after meetings? What's the deal here? And this is something which I think impacts all of us as effective managers. Let's keep it short. Let's keep it tight. Let's keep it concise. But you know what? We need to be sensitive. We need to go behind the scenes and inquire, which you will not get if you're talking about this over 5 minutes on a video call. So that's my view here.
Yeah, it's a very important point. We need to ask people how they really are. So our next question here is from G. How can we make our communication with our teams most effective and engaging, given that we're working remotely? So Woon Tech, you talked about preserving the human element. How would you answer that?
We need to recognize there is a need to have what we call online offline engagement. You cannot totally depend on remote working. So for me, I organize small groups engagement. Small group in which we go for a walk, we go for a run, we do things together, right? And you can do it in 4-5 people, and you build deep relationship. We got to understand we are social creatures that needs to feel, to touch, to interact. We are doing a lot of this in the remote control environment today, but nothing, nothing can take away the laughter to sit down together to enjoy a meal, all right, or the sweat that we go through by walking through the jungle, right? We need to have a balance of both remote and physical interaction.
It's a great point. And Kaushal, you talked earlier about the KPMG example of letting their employees work remotely. How do you keep teams motivated when you're working remotely?
Actually, I can give you 3 examples. One is the KPMG collaboration where we had celebrated our Women's Day by conducting collaborative webinar with Room to Read organization and KPMG, and that where we had 60 female participants, and it was a very successful program. The other one is the program that we have conducted since the pandemic occurred, is through the Lions organizations, and we had our quiz, and we have our awareness program, and we almost got close to about 10 countries at one time holding webinar with their collaborative effort. We got even UK, Tanzania, most of these countries where we would have never ever thought of getting them closer. And these collaborative effort with India and all these places was very innovative and was productive and informative. So we got the world international past presidents also to take part in these webinars. So these three exercises, uh, in 2 exercises, is mostly on CSR based. But what we are going to do with CMI, we have been in communication with CMI UK. We have a good demand from the youth and the young people, right, who are looking forward to have short courses on management, right? So we have our management expertise in our exco, and we are trying to work out short courses, because this had become successful stories in our Plastics and Rubber Institute also, where we started conducting all our courses online. So what I said at the beginning, the students that we could outreach who were far away, now they want to follow the courses. The same thing we want to do with the CMI management courses for the upcoming management interested youth.
Okay, so
This is
lots of celebrations you've staged and international collaborations, and then of course learning opportunities. Those are all good ways of keeping people motivated. So we're coming to the end of our time together. I'm going to take the last 2 questions and combine them into a last question, because they're great questions and they're related. So the first question is, a number of viewers have commented on the way in which cultural differences across the globe have been a major variable in terms of government approach and public compliance, and therefore rates of infection and death. Is the only way to overcome this to decouple health crises management from politics? That's one question. And a related question, it seems as though Western governments haven't learned much in the last 17 years, but there's an opportunity to learn going forward. So what do you think the UK government could learn right now from the experiences you've shared in Asia? So do we decouple health management from politics? And what piece of advice, what do you think the UK government could learn from Asia? Go on, Taranji, start us off here.
Wow. Okay, so my thoughts. I think we need to separate the truly important long-term considerations with the more frivolous shorter term. And when I talk about that, I'm not talking about the fact that it's not important. What I am saying is there is a deeper magnitude, and Wuntek raised this. And I would like to just highlight that it's a 20-year time horizon. It's a 25-year time horizon. And when I talk about the frivolous ones, it's 6 months, it's 3 months. It's important. But when we talk about the magnitude of risk that we are looking at, it's on a very different scale. So, yes, firstly, we need to separate the two. Otherwise, you'll find that we are constantly chasing our tail because that's what the public wants. And quite honestly, what the public wants and what the public needs are very two different things. With
So
all due
that's
respect.
it's a great insight. Paulina, what's your thought on that?
Well, what virus, illness have no eyes and they don't choose, and definitely cultural free. So we definitely, focusing on, resolving the problem and cure the diseases. And together, everybody wins, no matter what culture, no matter what politics. I think this is number one. And we have been doing that. Look at the vaccine, research and development. It is indeed, cross-cultural, cross-political, and we just need to pursue to the best we know how. And this applies to many things. If we can do it through vaccination, if we can do it through health and development, we can do it for the harmony of humanity with technology advancement. So,
I like that.
and with that.
I love that insight. Viruses have no eyes and they're not political. It's very true. Kaushal, what are your thoughts?
Actually, I agree with all my colleagues, and it's time to rethink, even for the government, to make things very purpose driven, and to see that not to have big plans over the next 5 years or 10 years, but you got to see be very focused than before, right? This is how it is happening in Sri Lanka, really, because we can see a lot of ideas, innovations that is coming out of the local entrepreneurs to make things happen. So I think that's the way forward, and respecting all the hygienic conditions and regulations by the state health
Okay.
authorities.
Thank you for that. Now, Wuntek, the UK has a lot of admiration for Singapore. So close us out here. What would you like the UK government to learn from Singapore?
Well, I don't think I can tell what the UK government can learn from Singapore, but my view is a very practical view. I don't think we can decouple health management with politics. Actually, the critical thing as leaders, and CMI is about leadership, is about moral compass. Mm-hmm. Here we come back to a very precious assets that all of us have, moral compass.
Yes.
What must you do right for mankind? Not today, not tomorrow, but build a better society for all when I'm not in this earth. Do we have this moral gumption and moral compass to do the right thing, to build a better mankind, a more inclusive society for all in the next 50 years? If we have this kind of thinking, we will know how to do the right thing, because the moral compass will guide us, okay, to go and persuade the voters. We got to do this, not for me to win the election, but for your descendants, for your children's future. We got to start to think about that.
So that's a very big thought and a very universal thought to end us on. Thank you, everybody. Thank you, Wuntek, Paulina, Kaushal, and Taranjeet. Your thoughts have been incredibly insightful. I'm sure our audience has learned a lot, and we will be sharing this also on our YouTube channels and LinkedIn. So thank you for joining us. If you've enjoyed this broadcast, please consider joining CMI. You can find out more information on how to do that in the chat. Thank you all. A great evening or a great day, depending on where you are. See you next week.
Thank you.
Bye.